Good evening, everybody, and welcome to the Understanding Medicaid Waiver session hosted by the Fredericksburg Area Council on Transition. Participants in today's session will learn a basic overview of Virginia's home and community waivers, the services provided under each, and the criteria for each waiver and how they apply. We'd like to welcome our presenter, Tennie Gratz from the Disability Resource Center in Fredericksburg, Virginia. Tennie has worked at the Disability Resource Center since 2005 and is a long-term care Medicaid specialist. She helps people with their long-term care needs to include Medicaid waivers and services that help individuals stay in their homes. She does community training on the waivers and the other independent living issues. Tennie is also a certified senior fitness specialist and provides training, health and nutrition classes weekly to individuals across the disability spectrum. In addition, she oversees a home modification program for veterans and various other projects. So thank you and welcome, Ms. Gratz.
Thank you for having me, and thank you all out there for joining today. Yes, I've been doing long-term care Medicaid trainings for a long time. Before I started as a long-term care Medicaid specialist, people were unable to access the waiver in Virginia because of having misinformation. And so therefore the state put together a training program for mentors all over the state of Virginia so that we could go out and do trainings and help answer questions and help people access the services they need. You know, the Disability Resource Center is an independent living center, and we serve all disabilities, all ages. So I'm going to do a little bit of background on Virginia Medicaid. Now, this is a 2020 slide, but you can see that Virginia Medicaid does spend $15 billion in that fiscal year for that includes federal and state funding. Virginia is a 50-50 state, meaning that Virginia pays 50% of that, and then we get funds from the federal government for the other half. Now, Medicaid mandated services, what that means is that all the states have to have these services in their Medicaid plan. And I'm not going to go through the whole list, but you can see what they are. So no matter where you go, you are receiving Medicaid services in that state, you will receive these types of services underneath their plan. Now, every state has optional services that they choose to pick to add to their Medicaid program. So in Virginia, they have selected these items here to be an additional amount of services that they will add to the mandated services that we saw in the previous slide. So why is that important to know? Because once an individual, no matter their age, is enrolled in a Medicaid waiver, they will receive a Medicaid card, and they will also receive all the waiver services and the state plan, the mandatory and optional services that Virginia is going to have. So that's a lot of different services that Medicaid will cover. When people are accepted into a long-term care Medicaid, they have additional services under Medicaid, underneath that Medicaid waiver that they've meet the eligibility for. So why home and community-based care waivers? It gives the states the flexibility to develop and implement alternatives to institutions. So in the past, instead of receiving services in their home, individuals with disabilities would have to go to an institution of some sort. Now we don't have to do that because of the waivers. So Virginia, home and community-based care waivers, what are they? So here, again, in Virginia, we have the Commonwealth Coordinated Care, or the CCC Plus waiver. A lot of you guys will know it as the EDCD waiver, but that had changed several years ago. They combined both the EDCD waiver and the TEC waiver, and now the new name is the CCC Plus waiver. The Developmental Disability Waiver, or the DD waivers, are Building Independence Waiver. And so that waiver there, the Developmental Disability Waiver, is like a big umbrella. And under that umbrella, they have three separate waivers, which they are called Building Independence Waiver, Community Living Waiver, and the Family Individual Supports Waiver. And then the third one that we have that's really not in use because everybody typically is going to the CCC Plus waiver is the Alzheimer's waiver. So long-term care institutions and waivers. So what does that look like? Now, some of these numbers are probably going to be higher than what you see, but this gives you an example of what we're looking at. 17,000 people in nursing home facilities, and about 1,500 are people with developmental disabilities. There are currently, and I think this number has probably gone down, are 600 people in the institutions for ICFs and IDD. There are 55,000 people enrolled in waivers, and I'm sure that number is greater than that now. And so, like I said, this is the fiscal year of 2020. So long-term care eligibility process, what does that typically look like? You would have to get screened first to see whether or not you meet the criteria for that particular waiver you're trying to get into. Then there is the financial eligibility, because Medicaid pays for these services. You would have to meet that Medicaid financial eligibility. And screenings for all waivers must be provided without cost to the individual. Long-term care Medicaid waivers pays in institutions. So must need long-term care. Why are you going for a waiver? Is because you need the help and assistance in home. So that assessment is going to be done by the screening team. The financial thresholds for Medicaid is income limit, and this is from 2021, of $2,382. Resource limits is $2,000. Parents and income and resources do not count regardless of a child's age. So with long-term care, and this is very important to understand, because a lot of people will get a denial based off of, does it meet the financial eligibility, meaning they don't meet Medicaid eligibility, and they're trying to get a waiver for their 10-year-old child. Well, that tells me that the Department of Social Service didn't do that assessment correctly, because with long-term care Medicaid, and you have to remember, Medicaid is a health insurance. Like any health insurance, they have different programs underneath their big umbrella. Long-term care Medicaid is one of those services under the big umbrella of Medicaid. Under that long-term care, they only look at the person with a disability. So that's why parents' income and resources do not count no matter what, okay? If you're trying to get your child into Medicaid for under long-term care services. That being said, a 10-year-old they're not going to even ask a parent of a 10-year-old to fill out their Medicaid eligibility is not going to be determined at 10 because they're underage. But when they turn 18, they are considered an adult. And as an adult, they're going to start looking at that child's financial eligibility to see whether or not they still meet Medicaid eligibility. That is very, very important for that disability determination at age 18. They have to maintain their waiver services. They have to also be Medicaid eligible. And they also need to get that determination done through, they can apply for SSI that will give that disability determination of having a disability. So under Medicaid, it's not just financial, it's also, you have to be fit into a category. And that category would be 65 years of age or have a disability. Okay, so what the takeaway from this slide is, Medicaid only looks at the person with a disability if they are applying for long-term care services, and that'd be waiver services. And at the age of 18, they have to get their disability determination to maintain their Medicaid services. So as an adult, there could be a patient pay involved. So some people make over and maybe their disability check, or maybe, their income is over that $1,300. If their income, let's say I had worked with a person transitioning him out of a nursing home, and he was making, through his disability, $1,800 a month. So now his patient pay would be the difference between that $1,310 and that $1,800 a month. So typically speaking, what that would do, he would pay his personal care attendant first until he met his patient pay, and then Medicaid would come in after and pay for the rest. Okay. And there are some exceptions for the persons who are working. The Department of Social Service is the agency that will determine what this patient pay. Again, Department of Social Services is who determines who's eligible for Medicaid, period. So they would be the person that would take care of all this determination for you. Alternative institutional placement. So again, Medicaid, this is under Medicaid, this is an alternative institutional placement, but the same criteria is used for admissions to the institutions, meaning you must meet the same criteria for the CCC Plus waiver, and that's for staying in the community with those same services as you would receive in a nursing facility. It's the same exact screening tool. And then the screening tool that they use for the DD waiver is going to be the same screening tool they would use as if you were going into one of those institutions. But of course, this is for community living. This is not that you're going into those institutions, but you have to be aware they're going to be using the same screening tools as if you were. So your screening contacts, this is who you would contact to start the ball rolling to try to get yourself into one and see whether or not you meet the criteria for these waivers. So the Department of Social Services or hospitals is who you would call for the CCC Plus waiver. Children under the age of 18 would contact the Department of Health. The reason why they have switched off from this Department of Social Services from doing all of the screenings for them is because kids, this is a nursing home level of care. So kids would not, the typical UAI that's being used is not going to always, and the questions that they're going to be using for an adult really doesn't apply for kids. So they had to redo it and make it more kid friendly and looking at the kids differently. So that is why the nurses from the Department of Health are going to be doing that screening for the kids. And that's who you would call. The Community Service Board is the agency that is responsible for the Developmental Disability Waiver screening. And that's for all of those waivers listed below. Now, the screening that is done is to see whether or not you're eligible for that waiver or for one of those three waivers and to be placed on a waiting list. So waivers for people with developmental disabilities. Their building independence waiver, their family individual support waiver, and the community living waiver. What is a developmental disability? Okay, it is a severe chronic disability attributed to a condition other than mental illness. It has to manifest itself before the age of 22 and of course continue indefinitely. And they're going to be checking for these limitations in 3 or more of these areas listed below. So examples of what a developmental disability, and this is a very, very short list. As we all know, developmental disabilities, there's many, many, many more, but you can see some examples of that. And so the screening tool that they use for the developmental disability is called the VIDES. And again, this is a screening tool that is going to look at 8 areas of life activities. Infants must have needs in 2 or more of these areas, and children and adults must have these needs in 3 or more areas. Also, remember they're going to be repeating this screening annually after you've been enrolled in the waiver to make sure that you still meet the criteria. So the next one is Building Independence Waiver. This one is for adults only, like more of a higher functioning individual who can live on their own. They don't need as many services and require minimum support needs. The Community Living Waiver, these are individuals that can live on their own in their home or apartment with up to 4 unrelated individuals or a family or a licensed residence. This can include extensive supports, may include medical and behavioral supports. And this is the only waiver with the group home and sponsor residential placements that has this particular, those services for this particular waiver. Family and individual supports waiver is individual that again can live on their own home, in their own home, apartment, or with up to 4 unrelated individuals, or with a family or a licensed residence, may include extensive supports, may include medical and behavioral supports. Now, with the other documentation that I had included, there is, and you can look at this later on, but it has a lot of different information, all the different services under the Developmental Disability Waiver. They have underneath, you'll see your little like BI is Building Independence, FI, Family Individual Waivers, and Community Living Waivers is under CL. And you see the check marks. What that does is tell you what those the different waivers have. What are their services? And it has a description of them on this paper. And so you can look at that and you can see just how many services are attached to the Developmental Disability Waiver. This waiver is very good. That's why there's a long waiting list though, because with that, these services, it costs more money. And so that's part of the issue of why there's so many people on the waiting list. And but once you're on it, I mean, especially as your child becomes an adult, you can see that these services are going to really, really help them maintain independence, maintain community living. And so, but you have to understand too that because of all the services, it does cost more money. So, and you guys can look at that some more. And if you have any questions about that, you can, like I said, talk to me. We can answer any questions that you may have. That gets back to my point I was making just a while ago. As you can see, there's that waiting list. So that screening that you are having done and you're found to be eligible and you go through the Community Service Board, they maintain the waiting list. So there are over 14,000 people on that waiting list. And of course, as I said before, there's more need of DD waiver services than money is allotted for. And so they're, like I said before, the CSB manages the process of aligning the slots to the people on the DD waiting list, and they manage, they manage the priority list also. And we'll get to that in a moment, because I also have a document that explains what that priority list looks like. The DD waivers are the ones that we have just talked about, the 3 different waivers underneath the big umbrella of Developmental Disability Waiver. They must be screened to be included on that waiting list. And it's only one waiting list. Before they changed this waiver, we had 3 separate waiting lists. So now they're all have merged in together. And about 35% of people on the DD waiver waiting list are currently enrolled in the CCC Plus waiver. So let's talk about that for one moment. What happens with this? So I talked to parents a lot about this situation. The Developmental Disability Waivers, of course, has a totally different screening tool done by a totally different agency, the Community Service Board, whereas the CCC Plus waiver has a totally different screening tool done by the Department of Social Services. An individual can be eligible for one of these waivers, but not the other. They do not talk to each other. They're 2 totally separate waivers. But there are some individuals that are going to be found eligible for the DD waiver and be placed on that waiting list. And there can also be screened for the CCC Plus waiver and be found to be eligible for that waiver. So while that individual is on the DD waiting list, waiting for however long, they can be receiving services through the CCC Plus waiver and be on Medicaid and receiving all the, optional and mandated services under Medicaid. So I hope that makes sense to you guys. But yes, that happens. It just depends on that individual person and if they meet the criteria for both of those waivers. Now we have the DD waiver waiting list, the priority list. And I'm not going to go and read through all this, but you can look at that and you can see, if you're you want to be on priority 1, of course. There you go. And there's more of an explanation for that. And one of the things I like to talk about with this segment is that with 14,000 people on a waiting list, you do know that you're going to be waiting for many years. So if you have your child placed on that waiting list at 10 years of age, and now he's getting to the point where he's in high school, he's 18 years old, he's probably not the same person. They grow up, they have different needs, there may be some family changes, their time doesn't stay still. It's what I'm getting at. And so you need to keep their intake worker, and they do send out information, or they should be sending out information once every year to update their information with the CSB. If something happens before that year, like say maybe somebody dies, maybe somebody's lost their job, maybe there could be a whole many different reasons of what's happening. You need to contact that intake worker, because that can up your priority depending on what the situation is. Now I will note that it says priority 1 is they need services within 1 year. That will not happen. But you will be, when a active waiver slot becomes available in our area, they are going to be looking at priority 1 before they, of course, look at priority 2 or priority 3. So anything that changes that you need to make their intake worker at the CSB know that. Make sure you fill out that form that they send to you once a year, and so they can update their records. It's very, very important. I will also say that case managers or intake care coordinators, or anyone, I don't know, whatever they call themselves, typically Sometimes they come and sometimes they go. So you need to be aware of who your person is so that they know who you are. So I think that's a very, very important thing to be more active in this process. So now we're going to get to CCC plus waivers. So right now there are two separate services that share the same name. Now this is very confusing. I don't know why they did it. Nobody knows why they did it, but they did it. So CCC Plus is managed care healthcare. That's your regular insurance, doctors, hospitals, medications, therapies, that type of thing. And then CCC Plus waiver are your long-term care services. Okay, so CCC Plus managed care, what does that mean? That means that DMAS hired 6 Medicaid managed care organizations, which I call MCOs, which everybody calls them because it's easier to say than managed care organizations. And they include Aetna, Anthem, Health Keepers, Magellan, Optima, United, and Virginia Premier. Most people with disabilities enrolled in Medicaid receive their Medicaid services through one of these managed care organizations. Regardless of which waiver people are enrolled in, they are probably enrolled in the CCC Plus managed care. But here is the difference. The DD waiver services, okay, waiver services are not managed by the MCO. This is what this means. CCC Plus waiver recipients, all of their Medicaid services, whether it's a regular CCC Plus, remember, just regular health care, doctors, therapies, medications, and their waiver services under CCC Plus waiver are managed by that managed care organization. So they do it all for CCC Plus. DD waiver, those individuals receive their health care from CCC Plus, but their waiver services, DD waiver services, is managed still for fee for service under DMS. Their waiver services are not managed by that MCO. Just remember, CCC Plus, everything that their healthcare and their waiver services is managed by one of these managed care organizations. DD waiver, their healthcare is managed by one of these MCOs, but their waiver services are not. It's separate. The Commonwealth Coordinated Care CCC Plus waiver, remember, combined the elderly and disabled with the consumer direction, with consumer direction, EDCD, and the technology assisted waivers together back in August 1st, 2017. And because they combine 2 waivers, you will see that now this waiver has more services attached to it. The eligibility remained the same. There was really, other than combining the services, how the screen works, all that kind of thing, that did not change. But you did get an added amount of services attached to the CCC Plus waiver. Their assessment, again, is done through a UAI. Remember, this is a nursing home level of care that they must meet. So what are they testing for? They're going to be looking for the combination of those items listed there, from activities of daily living, behavior, mobility, joint motion, medication. They also must need a nursing or medical need, and they are at risk of placement in a nursing home. So when you think about the CCC Plus waiver, what do you, when you go into a nursing home, why are individuals there? It's because they cannot maintain their independence in the home without care, getting up in the morning, getting dressed, showering, people making maybe some meals for them, making sure they're taking their medications, that kind of thing. So when you're thinking about the CCC plus waiver, you got to think about that nursing home level of care. So their services are listed here. Oh, and one of the things that was added to the old EDCD waiver, now the new CCC plus waiver, was the assisted technology of $5,000, the environmental modifications of $5,000 a year. And so those were the main two things that really elevated the old EDCD waiver into this new CCC plus waiver with those items there. So now you can get, assistive technology. It could be so many things. There's catalogs of it. And environmental modification is, of course, like bathroom modifications, ramps. They can even do modifications for a van, if that's the case. You would have to go through that MCOs, whichever one that you have, to help access those services. So the adult daycare is a group setting. It's social and recreational activities, and it is used by people, usually the elderly, who cannot be left alone. Next slide. There's, again, assistive technology. You would need a prescription for that AT evaluation. You need a quote, delivery after authorization. So you have to have that authorization before you can get anything done. And again, it's a $5,000 per calendar year. Personal and attendant care CCC plus waiver is assistance with ADLs and IADLs. It can be provided in any environment. You can have added supervision for up to 8 hours a day when the primary caregiver are working or going to school. Typically, when we see supervision coming in is for the kids during the summertime when parents are still working during the summer and the kids are off of school. So they need that extra hours. This can be provided consumer direction and agency services through either one of those. And then, of course, there's nurse delegation of skilled services is allowed. So both the developmental disability waivers and the CC plus waivers have a consumer directed services. This consumer directed service is where individual can hire their own PAs to provide assistance and activities of daily living. So, meaning, again, what is an activity of daily living? That is making sure people can get up and get going and get dressed and be bathed and have food and have medication. And those are those things that will keep somebody independent in their home. Individuals, of course, adults, can direct their own care. And individuals can choose a facilitator that creates a plan of care and conducts management training for employer of record. That is someone, it's like your own little mini business. So someone is going to be trained to hire. And of course, if they don't do their job, fire a personal care attendant. They direct their care. And they have to stay within that plan of care that the facilitator will get authorization for. If there is no employer of record to do that, or they can't find personal care attendants, then they can always receive this Medicaid service through an agency. So this is a slide that I just recently updated because the personal care attendants have gotten a raise of a 12.5 pay increase. So Northern Virginia rates are now $15.30. And now they can work overtime. Before there was a 40-hour cap. They could not work overtime, but now they can. And so they can work up to 16 hours of overtime. And so that overtime will be an extra $22.95 an hour. And then rest of state is a little bit, well, not a little bit, a lot less. Again, I don't understand. I will never understand why there's such a difference between Northern Virginia rates and the rest of the state. It's not like anything costs any less in King George or Caroline County versus, I don't know, Spotsylvania. So, but that's how they do it. So that's a good thing to keep on handy. This is a good list in case you are trying to find personal care attendants. You can let them know exactly what their pay would be. This is a consumer-directed primary care attendants that do not live with the consumer, okay? And all this started last July. One of the things, though, you have to remember, you got to stay within that plan of care. So they can work overtime. So if you have somebody who has 56 hours, they can go up to that point. But you have to stay within their plan of care hours. All right, so the private duty nursing is a continuous care up to 16 hours. The Department of Social Service will be in charge of this. They have a scoring tool, and these are people who are on oxygen or feeding tubes, something that is like it's an alternative, a combination of highly specialized and medical oriented technological support needs. So this is things that are keeping them alive. And a nurse will be there. And then the rest of those 8 hours in the 24 hours day time frame, they will train a primary caregiver to do those duties. All right, so this is the personal emergency response system. This is used to I've fallen, I can't get up kind of a scenario, but a person is not able to use the phone in an emergency. This individual must be 14 years or older and is left alone for a portion of the day. But they have to know when to use it. They have to have that cognitive ability to be able to use the device. So the respite is for the primary caregiver. The caregiver does not have to live with the individual receiving waiver services, and it can be provided in any environment. There's 480 hours a year, and their year is July 1st to June 30th. And you can have this under consumer direction or agency service. So 480 hours a year. Once it's gone, it's gone. And you can't get it back until the new year starts and July 1st. So yeah, you have to sometimes think about it and use it very wisely. So after all this conversation, who does what? All right. So we talked about managed care organizations. They have what is called a healthcare coordinator, and they are under Medicaid, and they help direct Medicaid recipients to the services that they need. They also, so if for instance, under the healthcare, if you're looking for a therapist of some sort, you can call them, because they are one assigned to you for your family or for the person with a disability, and say, I'm having trouble finding a therapist, and can you please help me? And so they can help direct you to who is a therapist that's under their healthcare. They also help with the CCC Plus waiver coordination. They're the ones that work with the facilitator, plan of care. The facilitator does not approve or not, their plan of care. It goes to the MCO. The MCO then will approve that plan of care or decrease it or whatever they're going to do with it. So the managed care organizations are in total control of how many hours an individual will get. The DD and ID case manager, they not just work in waiver services. There again is that person that helps help people with other services in the community. So if you're having issues, having problems, and they have the DD waiver, call your case manager. They're supposed to help you and direct you and find services that you need. And then the service facilitator, they work under the long-term care waivers. They do the training for the EOR. They help people troubleshoot. They go into the homes every 30, 60, and 90 days to see how everything is going. If there's any need to update that plan of care, change it in any way. And so this is a guide of who does what, because there's a lot of players in these long-term care waivers now. So like anything under Medicaid or most anything that I know, that if you don't agree with any decision Medicaid has made, that you have the right to appeal it. You have to do that appeal within 30 days. And the decision should be issued by the hearing officer within 90 days. And then Medicaid fraud, billing for services not provided, inappropriate services rendered, failing to comply with DMS documentation requirements, those types of things. They would like people to call that number listed or email them. And that's it. Again, my, questions, if I can answer questions, I'd be happy to. My information is listed there, my phone number, my email address. If you ever need to contact me with any questions, I know this is a lot of information in a very short period of time, but like I said, I'm here, and if I can't answer the questions, I have a contact that I can ask to get any kind of question answered. So
thank you so much for that, Tennie. Okay, we do have a couple of questions here. The first one is there a minimum age for getting on the DD waiver waitlist?
No, there isn't a minimal. You have to, again, I don't know that you should call the community service board. You can set up that screening, and if your child is found to be eligible, then they are placed on that waiting list. Now, I do know of babies being put on that waiting list because of their disability. And so the community service board will be able to address that if that's part of the question.
Our next one here is with 14,000 people on the wait list, is it something they should get on it before needed?
Absolutely. I say the sooner the better, no matter what the priority is. I will tell you that individuals that are starting to graduate from high school are put up on the priority list, because what they're trying to do is, because once they leave school, all their services are gone. So they're trying to maintain something for them, and so they're not sitting around waiting for a long period, for a long time. So the sooner you can get them on, the better.
Perfect. Thank you very much. Our next question: how can I get more information on how to become a facilitator in my area? Whereas I can facilitate care for people in my area that need personal care assistance. This is someone from in Orange, Virginia.
Okay, they would have to contact the DMAS website. There are tabs underneath, information. It's actually spelled out really good about what you need to do, and so that's where you would start that endeavor there. So Yes,
Perfect, thank
we
you.
need more facilitators, that's for sure, especially in Orange County, because that's a very underserved area out there.
Thank you. For our next one, it says, it's asking, my son is 12 and he's autistic. I'm just looking for all options that are available to him. Should I start with a DD waiver?
I would have him screen for the DD waiver, and depending on his disability, there are, like I said, there's 35% kids or individuals, some of them are now adults, young adults, that meet the criteria for the CCC plus waiver. But again, you have to think about that nursing home level of care. Okay, would he meet that level of, that type of screening? So only you can answer that question. But yes, definitely get him on the wait list for the DD waiver.
Perfect. And our next one is, where do you start with the Community Services Board?
So you have, depending on where you live, there are community service board in the counties. So you can look them up. I would, I don't know where you're from, but anyway, I think the PRCs probably have that information or can tell you, which direction to go into for that. And then request a screening for the DD waiver. And then they will do that either on the phone. I don't know how they're doing it actually. I know that I think the Department of Social Services are still doing them over the phone. But they will then tell you how the screening is going to work for you.
Our next question is, where do I sign up to be put on the wait list? This is for the DD waiver.
You have to call the community service board in your county that you live in and request a screening. And then if he meets that screening, if he meets that criteria, the community service board will put him on the list and maintain that list, him on that list.
Our son has Down syndrome and is nonverbal, and he's been denied for a CCC waiver twice now. We live in Caroline County and really cannot understand why he keeps getting denied. He's 20 years old.
I don't know. That's always a hard question to answer. Have they seen? I don't know. Have they seen him? Are you concentrating more on the things that he cannot do versus the things that he can do? This is a way you have to remember. They're doing a screening. And it's not anything about what your child can do at all. It's about what he cannot do. So as a 20-year-old, what is it that he is not doing? What does he need help with? What, all those things. That's very, very important. You have to paint that picture to them, especially if they're doing. Okay, that's good. I saw that. Okay. So I do not know. And I would, what I would do is then ask for specific criteria as to why he was denied. Because you have to be able to appeal that. Does he receive Medicaid? Is he Medicaid eligible? Does he have his determination done? Is all that been done? Okay.
And he has SSI, yeah.
Yes, okay. So if you were not here, then he would absolutely be going into a facility. He would be in a nursing home as you speak. You have to be very, that might be hard for you to say, but yes, yes. That's exactly what you have to say.
We have another question here. My 18-year-old son is already on the DD waiver waitlist. I'm interested on the CC plus waiver. Where should I start?
Well, you need to call the Department of Social Service in the county that you live in. And you said he was 18, right?
Yes, correct.
Okay, so that would be the Department of Social Services, and request a screening for long-term care.
I do have a couple of questions here as well. Who can I contact to find out where my child is on the DD waiver waitlist?
Yes, I will give you Jen Akers, ACORS, her name. You can contact her and ask her where he's at. Her phone number is 540-389-8255. 373-3223.
I think Courtney is typing that up, and there she is. Thank
There
you.
go. Okay. So, and she would be able to answer that question. She works for the CSB here in Fredericksburg, and that's a go-to person I send other people to who have questions about waiting lists. She
Perfect.
can get that answer.
Our next question here is, are behavioral issues considered a disability for CCC plus waivers?
They can be, especially, again, you have to paint that picture about what's happening. Why is he in danger to himself, other people? Don't let anything, again, they're there to find out whether or not he meets the criteria. And it's not anything about what they can do, what they can't do, how their behaviors are. What is that? Does he need to be directed to, go to sit down and eat? Does he need to be directed to get dressed? Does he need to be, all those things that is not a typical, and I'm air quoting here, person that needs assistance with. Okay, so he should be doing X, Y, and Z, and he's not. And this is what this means, and this is what he does, and this is how much danger he is in. So yes.
Perfect. I know you did address the minimum age for a DD waiver earlier on, but is there an age limit on the CCC plus waiver?
No, it's just all about criteria if they meet it. Now, I will say, coming down to small children, and I'm talking babies, toddlers, 5-year-olds, those that age group there, it's harder to get into the CCC plus waiver because of, parents are going to take care of their kids. If you think about the nursing home, people are in nursing homes because they can't get up, or they can't get dressed, or they can't feed themselves. Well, you're going to do all those things for your child. That being said, depending on the disability, again, extra help, that medical need, is that something that is going to make them eligible? And therefore, I would go ahead and have them screened for, have that eligibility, that screening done for the CCC plus waiver. I can't tell people that they won't get in, but what I can tell people is what I hear. And what I hear is that it's very hard for young children to get into it because of the fact that they have parents that are going to take care of them for those needs.
A second part of the question just came through. She's asking specifically for a maximum age. I feel like I've been told they needed to move over to the DD waiver for when they are 18 years of age.
No. People stay, CCC plus waiver is for all ages. We have elderly people who are almost 100 years old on this waiver. It doesn't matter, okay? It's whether or not they meet and maintain the eligibility for that waiver. Doesn't matter the age.
Perfect. Another question that we have is, what happens to my Medicaid eligibility when my resources are over $2,000?
You will lose your Medicaid. So what you need to do is talk to your eligibility worker at the Department of Social Services. They may try to work with you on that. It just depends on what the situation is. I won't pretend to know what the Department of Social Services is going to say. So yes, you will lose your Medicaid eligibility. And also, for parents out there who want to save money, okay, this is very, very important. There's special needs trust, there's the ABLE accounts. Don't put their money in any other kind of savings accounts or checking accounts or anything like that. Tell grandparents that you don't want them to put money into those kind of accounts. It needs to be in a special needs account or ABLE account, so it does not count against their Medicaid eligibility. So you can save more money, and you can, do things that you want to do and help them out as they get older without that risk of losing Medicaid.
All right. Well, on behalf of FACT, thank you for attending today's session on Medicaid waivers. And thank you, Tennie, for your time and expertise. I also want to take a moment and share the website with participants if you have not seen it yet. This is our website. You'll see the phone numbers here for Caroline, Spotsylvania, and Stafford Parent Resource Centers, as well as a Disability Resource Center. If you could not access a copy of the helpful links document in the chat that we posted, which contains the presentation that Tennie shared, as well as all of the resources, you can find that right here under the presentation materials and handouts for the February 17th session. So if you click on that, you'll go straight to the helpful links document, which has all of these. Tennie's contact information is on this sheet as well. Take a look at the different sessions that we already have up. There's a lot of good information on here, and thank you so much for joining us.